warm. But alhamdulillah for everything. Lovely to hear that from you, Sister Aisha. Assalamu alaikum, Asma, and welcome back to Urban Women.
Wa alaikum salam wa rahmatullahi wa barakatuh. Today I got such a warm welcome.
Well, the message said spread a hug, so Sister
And it was
Razia got-
wonderful.
And I had to. I told you I'm a man of my word.
Yes.
So alhamdulillah, firstly, have you been feeling the cold this winter?
Not as much, I feel, as the previous years. It's
Yeah.
been chilly, but I feel like we're managing. I
Yeah.
haven't really cracked out the big coats just yet.
Yeah, the temperature has been like 21, 22, 23, 24, hovering around that, 22, 23, which I think is perfect.
Yeah, it's
Isn't that perfect weather?
exactly. But those in Joburg and Cape Town, they've had it worse than us. So
Yeah,
I
they
think we don't
always
have
do.
much to complain about.
We are in Durban. We just love it. It's all the Durban humidity. Absolutely wonderful. Now, there's a wonderful topic we're going to be talking about because we don't realize what parents actually go through with children who actually have special needs. And I think dental health is also something that we cannot overlook. So if we just jump straight into it, we know that dental health is important. But why would you say dental care is important for children with special care needs?
So actually, this topic today was requested by a patient of mine who has two special needs, two autistic children. And he mentioned that I don't ever talk about kids with special needs, and it's so true. So I think it's important that we also bring them into focus because they do have, oral hygiene needs. And managing children with special needs can be very challenging, especially the oral health. These children have any form of physical, mental, or cognitive or emotional impairments, and it requires medical management. So managing them at home dentally is very difficult. You tend to not worry about their teeth as much because they have other pressing issues that you need to focus on. And also parents tend to neglect them because they have a lack of awareness or overcaring nature, or as I said, the greater focus is on more urgent medical needs. But unfortunately, these factors increase the risk of developing oral diseases throughout the child's lifetime. So if you are a parent of a special needs child, today we're going to discuss some of the tips or some of the options you can consider for your child's dental care.
Yeah, as you said, there's so many things to consider when taking care, and Allah Azza wa Jal make it easy for the parents. You shared something very significant that actually touched, I think, Tobeka's and my heart. But maybe if we have time, we'll chat about that a bit later. But what are the most common disorders in children with special needs?
So the dental status in children with special needs is related to their disabilities, okay? These children are at an increased risk of oral diseases during their lifetime. So some of the disorders that we can observe is autism, or if they have anxiety or ADHD or ADD, then other disorders such as Down syndrome or heart diseases, developmental disorders such as cerebral palsy or intellectual disabilities, or if they are born with orofacial defects, like if they have a cleft lip or a cleft palate, or oral cancer, then they will all fall under, patients who have special needs and who require extra special dental care.
I think when we have kids that are just naughty, we have to be so grateful because we're always finding something to complain about.
Yes.
And as Surah al-Baha always tells us, that there's always, basically in a nutshell, look at somebody worse off. So there's always somebody worse off than you. And parents who have children with special needs know what that's all about. So if your child is naughty, are they healthy? Say alhamdulillah.
Alhamdulillah.
And what are the most common problems that are actually found in these individuals? What would they include?
Okay, so you need to look out for cavities, of course. Those are something obvious that everyone can look at. There's a rotting teeth. You look at the front and the back teeth, right? But that's because it's due to factors such as, not being able to clean properly, or dental malformations, or high carb diets, or frequent exposure to sugar containing medications, and a reduced salivary flow.
Right.
Then the other one is malocclusion. That means they're not certain genetic disorders, for example, Down syndrome, can cause delay in tooth eruption. So your jaw doesn't bite or occlude properly.
Right.
And yeah, they take very, very long to form, or sometimes they don't fully form, or some of them have extra teeth or even missing teeth, and that all affects, it causes poor crowding or poor alignment, and it does increase the rate of tooth decay and gum disease. Some of them have swallowing difficulties. So if you see them, not being able to swallow properly, this results in food staying for a long time in the mouth, which can cause decay again and a gum disease.
Yeah.
Tooth wear, in cases of severe intellectual disabilities or cerebral palsy, children, they grind their teeth, making them flat. And as time goes by, it wears down the enamel and the dentine. This one is important. It's gingival overgrowth. So certain medications like epilepsy medication, they cause enlargement and overgrowth of the gums, which makes it difficult to clean. So plaque gets stuck in, and then you get accelerated gum disease. Then gum disease itself, this is because of lack of basic oral care, like not brushing properly and the plaque build up. This results in gingivitis. I'm sure everyone knows what's gingivitis by now.
We should know.
Yes.
Asma always reminds us.
Yes. Then a dry mouth because, again, of medications. And then sometimes just erosion because some of them have a reflux or, again, through medication.
I just want to put it out there. You know what's gingivitis? Let us know. Drop us a WhatsApp. You'll get 10 points from Asma. Absolutely. Now, Asma, this is so important. It's such an important topic. And as you're speaking, my mind is going through and I'm thinking about these parents, thinking about these children, thinking about the side effects that you mentioned of the meds that obviously are so necessary and important for them to take. What are some of the oral care tips that you can actually share with us that they can practice?
Okay, so the most important one is the medication. When your doctor prescribes the medication, especially if they're going to a government facility, inquire if there are any sugar-free options. So, they won't rot their teeth, and make sure if they have to take the medication, make sure that the child rinses out with water after each dose because that helps to clean out the mouth. Then brushing and flossing, obviously you or a helper, the parent or the helper is going to have to help the child to brush. Flossing, I mean, that's a bonus, but brushing well is very, very important. Because they can't reach the back. You have to make sure, and they don't have the dexterity on their hand to brush. So you've got to make sure you are there when they are brushing. Then fluoride, you use a toothpaste that's high in fluoride. Then your diet, you limit sugary sweets and snacks and ensure that they rinse out after a sweet treat. Lots of water is very important. And then dental visits. You may think that you have a special needs child and they're not complaining of toothache, but a lot of them don't register toothache or teeth problems or even a gum problem.
Right.
It's important that you find a dentist that your child will be comfortable with from an early age and ensure that they go up for checkups at least, 6 months. Because what happens is they ignore it and then the kids need a whole lot of dental work and it becomes very, very difficult for the child and for the parent. And again, each dentist has a different approach for treating children with special needs. So find a dentist that you and your child are comfortable with.
That is compassion, I think. It's so important.
It's very important.
Let me sort out your teeth and keep on moving. No, because children are they're emotional beings. They pick up on your energy and the love that you give them. That's so important.
100%.
Yeah. So thank you so much for sharing that important line. As you said, prevention is better than cure. So that 6 months, I think it's very important.
Correct.
I learned it. So I make sure that I try and do that.
Now you're a very good patient.
You're talking about like children picking up and it's tough for them to actually grip on. And I'm just thinking at how everything is related in the body. So you may think your teeth, your gums, your mouth, it's isolated. It's not. When I fractured my spine, I couldn't even pick up. Let's use the miswak.
Yeah.
Rebecca's going to start using the miswak, by the way. So she wanted me to show her how. So alhamdulillah. So I couldn't pick up and brush because my spine was injured.
Hurt,
and then you realize, wow. That's why I say, often we look for problems, we look for things to complain about, but we have so much to be grateful for until 100%. It's taken away from us. So don't get to that point. Gratitude is a magnet for so much. Wonderful topic. Thank you so much, Sister Asma. Share with us something about the miswak with regards to dental health.
Well, I love when patients use the miswak because you're using it often during wudu.
Yep.
And that's clearing out the plaque. So you're eating your sandwich or your rice during the day, and all that settles in your teeth, especially carbohydrates. It breaks down in your mouth. When you're using the miswak, you're cleaning it out. And apparently, the miswak has something in it, like a bit of oil in it,
Yeah.
naturally, that also strengthens the gum.
SubhanAllah. There's a wonderful video, and I've been telling Tobeka about this, and I'm going to play it on our show, inshallah, next week. It's just about finding it, where there's a white dentist that's talking about the miswak. She says about the miswak, it's really good. And she says it's just all about hygiene. So you just nip it off.
And yes, exactly. And it is hygienic,
But she was so amazed at the benefits of
the
it.
miswak. Yeah.
And to think, subhanAllah, whatever is a sunnah, there is such magic in it, and that's my firm belief.
Tobeka looks old already.
She's got her miswak. So we're going to just do this for her, clean it up, and she's going to be enjoying it, inshallah. Until then, Asma, always wonderful having you on the show with us. We know that you're getting ready to pack your bags and be a jet setter. So all the best for that. And we'll connect with you when you get back.
Inshallah. Until then, make sure you're using a miswak and keeping your teeth clean.
We'll use
no dental
miswak,
emergencies.
Inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh.
Positive vibes with Razia Language.
Urban Woman, sponsored by VADA.